This graph right here measures, so upper, middle, and working are income classes that have been designated by, I believe it's the US government. If you look at these charts, orange being the white net worth and black being the blue being black net worth. And I don't have a data for other communities of color, but these are probably the starkest differences, other communities of color probably layering in between. It's obvious to see the difference between the net worth of both upper class white and black folks, middle class middle class black and white folks, and working class black and white folks. In fact, an average middle class family has a net worth of $50,000, whereas a middle class black family has a net worth of $15,000, which is still lower than the average net worth of a working class white family. So what does this tell us? It tells us that it's not enough to measure our impacts of our public policies just by class, because there's a lot more going on under the surface because of the way that we've created our public policies that have created opportunities for wealth building in certain communities and others are not. And wealth is very, very important because wealth means your opportunity to send your child to college, your opportunity to buy a home, which then helps to create more wealth in your family, etc. So another couple of statistics that help us see why looking at poverty and class is just not enough. African American male and female life expectancy rates are lower than those with much lower incomes in China, Jamaica, Costa Rica, and parts of India. Minority patients are also less likely than whites to receive the health care they need, even after taking into account racial differences in health insurance coverage and other economic and health conditions. So it's not just enough to say, well, it's just because they can't afford insurance. Because of the way that our physical spaces have been built, where certain healthcare facilities are, whether or not a person is able to speak the main language that is offered in hospitals, what access people have to good healthcare infrastructure, such as food systems, like Dr. Sanchez had shared yesterday, all these things make a difference in the way that our health outcomes come out. So let me go into a little bit of history for how this has been created and really why our system looks the way it is. So it's not inevitable that we have a middle class in this country. In fact, that's very much a creation of public policy decisions that we have made really in the past century. And a lot of them coming really out of the New Deal. So in the 1930s, the Social Security Act was passed, and at the time it was a very novel idea. The idea that you had paid your debt to society and that society was going to take care of you in your old age. This was not an inevitable thing, right? There was a time in which people had to work forever, and you were on your own, which I'm not saying that doesn't also exist today. But Social Security was a huge wealth builder because for the first time, people were able to collect money once they retired, which then freed the burden of their future generations to take care of them. And it also allowed them to have financial security where there was none before. When this policy was passed, there were two of the several working areas of work that were not covered under the Social Security Act were domestic labor and agriculture workers. Well, 80% of the African American population were concentrated in those trades. So as a result, 80% of African American families did not benefit from one of the huge public policy decisions that ended up benefiting a lot of Americans. Well, how does this manifest? Over generations, because wealth is passed on over generations, that's 80% of a population that was not able to access a huge public policy investment in people. And again, this policy did not explicitly say that certain people of certain races were not able to benefit, but it's a perfect example of how looking at impact is very important in understanding how our policies are made. And it also is a perfect example of showing how it's not just black folks that were impacted poorly by this decision. There were many poor white folks as well. But the truth of it is, without understanding the way that racial impact is disproportionate across race, then oftentimes we don't see these bad signals. Another perfect example is the Federal Housing Administration. So there was a time in our country in which the FHA was actually underwriting over 60% of home loans. And there was a time in the very recent past, before really the 40s and 50s, when it wasn't actually very normal to own a home. It was a big deal. And it was public policies through the Federal Housing Administration that really invested in home ownership, that said home ownership is a value, that people deserve to own homes, and that it really helps to create wealth in this country. Well, the way that there was a process in this country called redlining, which basically banks were drawing red lines around communities of color and integrated communities. So even when communities were already integrated, it was considered a liability for banks to lend money to those communities. Well, what happens? This was also a process of suburbanization that was happening at this time. So many white families, many of them first-time homeowners, were encouraged and underwritten by banks that were underwritten by the US government to buy homes in suburbs that were then segregated communities, and took away a lot of the investment in inner cities. And what we saw over the 50s and 60s was that many white communities fled to the suburbs. Many communities of color that were not able to access a lot of these home loans, and sometimes explicitly discriminated against from buying homes in these suburban communities, were left in inner ring cities that were very disinvested in. Public schools in these places, because the tax base was low, started to crumble. Public infrastructures crumbled. And then now what we're seeing is kind of a reverse cycle, where a lot of money and folks with basically the tax bases are starting to come into cities, but the communities that were formerly left there are starting to get pushed out. So I illustrate this example just to show how these things are not inevitable. These things are policy decisions of how we decide to spend our taxpayer money, and that it's also a powerful tool for us to understand how we can create wealth-building opportunities in all communities. So you all know about the GI Bill, I'm sure. After World War II, many GIs coming back from the war were able to both access the Federal Housing Administration programs that gave them an opportunity to be homeowners, but also go to college for the first time. There was a time in which going to college was not necessarily very normal or accessible, but after the GI Bill passed, many families had people go to college for the first time. However, because the Army and the armed forces were very racially segregated, the majority of the beneficiaries were white. Of the people of color that were able to get into the Army and the Navy and the other armed forces, many of them coming out were funneled into service sector and menial jobs as opposed to college four-year degrees. And last but not least, the Federal Aid Highway Act. So at the same time that our city centers were suburbanizing and many of the wealth was fleeing inner cities, there was huge, billions of dollars of investment in creating an interstate highway system, which then incentivized suburbanization, but also cut through many vibrant middle-class people of color communities in city centers. And there are examples all over the country where this has existed. The South Bronx in New York is a perfect example, and I'm sure there are some here in Texas, where there were communities that were vibrant and against all odds, had a thriving middle-class community. Many of them were undermined because of the public policy decisions about where we invested this money. So what is this? How is this manifested today? When you look at rates of where people of color tend to live in this country, it's pretty astounding to see that although these numbers are not necessarily up to date, these numbers are from the 2000 census. 24% of people, so let's see here. On the top bar, that's the percentage of people living in concentrated poverty, and the bottom is the percentage of the population. So although in 2000, non-Hispanic whites made up 75% of the population, they only made up a quarter of those living in concentrated poverty, contrasted with 39% of black communities and 28% of Hispanic communities that were living in concentrated poverty. So because of the public policy decisions that we've made, which have basically said where certain people can live, where people can buy homes, this is the picture that we see today. And this is significant because if you think in a structural way, where you live has everything to do with the kind of house that you have access to, the quality of environment that your body is exposed to, the quality of schools, the quality of jobs. And so a house is not just a home. It's really the set of opportunity structures of what you can access. And what's also significant about this is that when you look at rates of income class across race, many communities of color, even though they are middle and upper class, often live in higher poverty communities because of this history again. So even though it's not enough to just, as a person of color, get a good job and assume that that's going to make everything change.